Good morning, my name is Andrew Davenport. I work at University College London and the renal unit is situated at the Royal Free Hospital. One of my main interests is in dialysis, and today I've come to talk about hemocompatibility in the dialysis circuit. The dialyzer is only one component of the dialysis circuit, but the majority of dialyzers used worldwide are what are termed synthetic membranes. And these consist of a basic polymer, to which other chemicals are added. And in terms of creating the dialyzer, not only are the capillary fibres, but they are housed in a plastic casing. And to connect the dialyzer together, certain glues or potting compounds are used in the manufacture of the dialyzer. This allows the possibility that some of these chemicals can be washed back to the patient during the treatment. And therefore it's important that dialysis circuits are well rinsed prior to connecting to the patient, so minimising the patient's exposure to some of these chemicals. In addition, as blood crosses through the dialyzer, there is activation of leukocytes and monocytes and platelets, and this increases the risk of clotting as blood passes through the dialysis circuit. So one of the issues is whether dialyzers can be designed to try and reduce the risks of clotting within the dialysis circuit. And so we have looked very carefully at some of the ways possibly of modifying the dialyzer surface to reduce the risk of clotting. These include some simple issues in terms of surface techniques and surface technology, but also whether additional chemicals, or particularly molecules such as thrombomotilin, which may reduce the effects of clotting, can improve hemocompatibility with the dialyzers.